Cosmetic surgery has boomed during the pandemic. More people than ever are going under the knife for a little nip and a little tuck.
Well, here to fill us in on some of the hottest procedures is plastic and reconstructive surgeon, our friend Dr. Christopher Johnson. And Dr. Johnson, what is going on? Why is everybody going under the knife?
It is a boom. We've never seen more plastic surgery across the country. We can't keep up with it. It's probably the most work we've had in 20 or 30 years. I think it's because many people are at home, working from Zoom. And if you have a little tuck, who knows? No one can see the bruising on Zoom. Nobody can see that you can't sit down or you're walking funny.
And people are staring at themselves, I think, more than ever, seeing like, oh, maybe
That's
this
part
or
of it,
that.
too.
Or what's the #1 most popular procedure?
Well, you say can't sit down. Is that the caboose?
That's the Brazilian butt lift, where we advise patients not to sit very long.
What goes into that?
So the #1 procedure that we're doing right now is this. It's liposuction 360. That's a circumferential liposuction of the torso area. And then mainly ladies put the fat in their hips and their buttocks. So we transfer the fat.
So you get it sucked out and then re-put where you want.
Put it right back.
Was that the Cardi B kind of effect? Because she talked about the lipo was working, it was settling.
Yeah, so it's all about creating this silhouette with a tiny waist, and then that curvaceous hip and the protrusion of the buttock backwards as well.
What celebrity besides Cardi B do people come in and say they want?
Nicki Minaj, Jennifer Lopez, and Cardi B. Those are the big ones.
Really?
Yeah.
People walk in saying, I want the Cardi B situation.
They do, and I think it's really being driven by social media. Because if you look at the influencers, the young influencers, they all have this very
hourglass almost.
Hourglass silhouette. And 30 years ago, we liposuctioned people's buttocks and hips. And now they want that. So it's evolved, and I think it's really been driven by social media.
Now, have you ever had a scenario where you said, baby, we can't do what you're looking for?
You know, if someone asked me to put 2 liters of fat in each buttock, I would say no to that. And I have said no.
2 liters?
There are people who, they come back, they want to get bigger and bigger and bigger.
Like 2 liters is what you get with a pizza.
Well,
right, like a Coca-Cola, or, you know what I mean? Like that's
exactly.
That's a lot in the rump shaker.
But if you are a social media influencer, bigger is better, isn't it? You get more people to sign on to it and become your followers.
Lord have mercy. All right, what's the second procedure that people want most?
Breast lift and breast augmentation, but lifting the breasts.
So the
and if they've
boob
gone
job
bigger
is
or smaller?
Yeah.
So most people for the breast lift are going slightly smaller. If they're doing a breast augmentation with breast implants, what we've noticed is people are asking for smaller implants than they did before. So no longer are we getting a liter or 600cc implants. They're about half that. Most women are asking for like 300cc implants, which is...
Let us hold these. So what's this?
So this is an anatomic implant. This is sort of for an older woman. It's not that round implant that you see on a lot of celebrities. You can see it's teardrop shaped, so it's bigger on the bottom and smaller on the top.
And is this...
That's the gummy bear.
The gummy bear.
Silicone gel matrix implant. That
awesome?
feels natural. It responds to touch.
And it doesn't leak.
It doesn't leak. Women downsizing. That is a big trend right now, that they're taking out the large implants and then putting in a smaller one.
This is fascinating.
The silhouette's changing again on the top.
Okay, wait. Is that the same one as this one?
This is a round one. This is for younger women. It's less natural looking, but if you want that round Janet Jackson-like breast implant.
Let's hold
Miss Jackson, if you're
Okay,
nasty.
wait. So what's the third most common procedure?
Third most common is tummy tuck.
Tummy tuck.
And this is part of the mommy makeover.
It's called the mommy makeover.
Right?
I've just learned all about that.
Mommy makeover is a breast lift with tummy tuck and liposuction. And now they're adding fat to the buttock, too.
From that?
Yeah. It's after you've had your children for women, breast lift, tummy tuck, liposuction of the flanks and back, and then very often we're putting fat in the hips and buttock.
And what about, are people going out of the country to get procedures done?
Sadly, We are seeing a trend for people
Give me the boob
to
back.
do destination plastic surgery. They're going to Mexico, they're going to the Dominican Republic. They come back after a week, and if they have a complication, it's hard for them to get there. I just operated on somebody a week ago who nearly died after going to the Dominican Republic and had a terrible infection of her abdomen.
Because they're going to the Dominican or going out of the country to save money.
It's a price point issue, but imagine if you have a complication, then that's not good. And I actually think our prices are competitive. There's so much volume of plastic surgery now that you can get a competitive price with the Dominican Republic, especially with the flying and hotels and everything like that.
Dr. Johnson, thanks so much
Thank
for
you so
sharing all
much.
this info with us.